2000 में CKD किडनी इशू डायग्नोस हुआ। काफ़ी रिसर्च में मुझे पता चला कि पाकिस्तान में फर्स्ट टाइम ज़्यादा ही हॉस्पिटल में स्टेम थेरेपी स्टार्ट की। तो मैंने फौरी तौर पे कंसल्ट किया, मेरी टेस्ट हुए, रिपोर्ट्स हुई, उन्होंने कहा कि आप बेस्ट कैंडिडेट हैं स्टेम सेल्स के और इसको हम इसको लेके चल सकते हैं। 4 थेरेपीज भी हुई और मैं अपने आप को बहुत एनर्जेटिक बेहतर फील कर रहा हूँ। किडनी जो इश्यूज थे वो नॉर्मल में आ गए, शुक्र अल्हम्दुलिल्लाह। मेरा मैसेज ये है कि किसी बड़ी ट्रीटमेंट से पहले एक दफ़ा इस थेरेपी में आप ज़रूर कंसल्ट करें। स्टेम सेल जो है अल्लाह ताला ने ही इसमें बहुत सी चीज़ों का क्योर रखा हुआ है।
मेरा नाम सिकंदर अली है, मैं सियालकोट सुमेयाल से आया हूँ। मुझे 10 साल पहले मैं अपने दोस्तों के साथ नहर पे गया था, वहाँ पे मैं गिर गया, उसकी वजह से मेरे जिस्म का तमाम हिस्सा जो है नज़र हो गया। फिर इसके बाद मुझे रमज़ान सीधा हॉस्पिटल का पता चला और हम यहाँ आए और यहाँ आके हमने स्टेम सेल से अपना इलाज करवाना शुरू किया। अब मैं थोड़ी सी स्पोर्ट लेने के ऊपर तो बैठ सकता हूँ, पहले मैं बिल्कुल नहीं बैठ सकता था। इससे मुझे काफ़ी ज़्यादा बेहतरी है। मुझे उम्मीद है कि इंशाल्लाह मैं बहुत जल्दी ठीक हो जाऊँगा।
मेरे बेटे का नाम है फ्रीडून साहब, इसकी एज है 9 माह के बाद बैठना उठना भी ना शुरू किया, हमने चेकअप वगैरह करवाने शुरू कर दिया। पहले तो ये ना मतलब चीख पुकार बहुत ज़्यादा करता था और जो है ना अब ये काम करता है और ये ना वाशरूम में जा सकता था। अभी ये बोलने कुछ वर्ड्स लगे हैं, हमें माशाल्लाह इसकी बहुत ज़्यादा तकलीफ मसला है। हमें क्या हमारी फैमिली में जितने भी रिलेटिव है ना ये जाता रहा है तो अब उनको काफ़ी ज़्यादा इसमें तब्दीली आगे से बेहतर उनको लग रहा है। पापा की तरह पापा बोलो।
Stem cells can be in some cases used to save lives, but very importantly also improve the quality of life for many patients who do not have any other option. I've just shown 3 different patients, and I've done a couple hundred by now, and a huge array of different patients. We have treated kidney patients, osteoarthritis patients, neurological diseases, Parkinson's disease, premature ovarian failure, erectile dysfunction, you name it. Pretty much we have covered every different organ, targeted every different organ with stem cell therapeutics. So one of the first questions that get asked is, what is the prognosis, how much improvement will I get, and what is the probability? So generally there are 3 things that determine that. The age of the patient, the older we get, the more compromised our ability of stem cells to do a repair job becomes. So the older patients, we need to use a much larger quantity of stem cells to achieve the results. So it's the age of the patient. The next factor is the severity of the disease, how severely a disease is affecting a person. For example, in case of spinal cord injury, how much damage are we talking about? And thirdly, and also very possibly, is the duration. How long has it been since the patient has been suffering from CKD, for example, chronic liver disease, chronic kidney disease, or spinal cord injury. So these are the 3 factors generally that influence the outcome of the therapy. Actually, we have already seen the video. As I mentioned, how do stem cells help our patients? So when our tissue or organs have lost their cells, we need to replace them with stem cells that can perform the functions of that particular organ. So stem cells have these 2 very remarkable abilities. They can make many copies of themselves, and again they can be, when they go in a tissue, they can also be tricked into performing the cells of their predecessors, the cells that have been lost. The way I explain it generally is that stem cells को आप ऐसे समझ लें कि एक अच्छी पास है, और जो हमारे किडनी के cells हैं, they have already done their PhD. So these cells, since they are naive, they can be trained into performing functions of different organs. Kidney में जाएंगे तो they can augment the function or start performing the function of kidney cells or liver cells, so on and so forth. I'm oversimplifying things here, but just to get a message across, I'm using this analogy. Okay. So when I first started working with stem cells, the first resistance was, okay, what you're doing is very unethical. Okay, there's, using stem cells is very unethical. People were right from their perspective, because there was a lot of publicity about embryonic stem cells back in the day, and people equated all different stem cells being embryonic and resulting in death of a fertilized egg. And I'm not going to get into a philosophical debate, but many people consider destroying an embryo equal to a murder. So anyways, embryonic stem cells के बारे में I just like to say a few things. The reason I'm going to tell you about all these different stem cell types is because in your practice and in your profession you are going to come up with different cells in literature. कहीं जगह पे आपको लगेगा कि stem cell therapy का बहुत फायदा हो रहा है, और कहीं पेपर देख के आपको लगेगा कि stem cell का फायदा ही कोई नहीं हो रहा. You have to pay attention to the type of stem cell being used. That is very important कि कौन से stem cell पे किस किस्म के results देंगे. And additionally, आजकल जो हमारे माशाल्लाह patients आते हैं, they are very well informed. I have received several stem cell lectures from my own patients. वो सारा net पढ़ा के आते हैं. So it is important that you know what are the different type of stem cells, what are their pros and cons, and how we can use them to help people. The first category is embryonic stem cell. So as I mentioned initially, there was a dilemma that using embryonic stem cells is unethical because it did result in destruction of a fertilized egg or an embryo. But there are technologies that allow you to remove a single cell from a fertilized embryo. It's called blastolea biopsy. You can retrieve a cell from an embryo, fertilized egg, and you can plate that, and you can get many hundreds of cells or millions of trillions of cells out of that one cell. So it's no longer an ethical dilemma here. Embryonic stem cells have a much greater ability, almost unlimited ability to differentiate into any type of cells. Adult stem cells have certain restrictions, but the potential of embryonic stem cells to develop into, differentiate into any type of stem cell makes them a very useful, very potent therapeutic tool. They have unlimited ability to renew themselves. They can make unlimited copies. It's infinite. So as long as you keep on feeding embryonic stem cells, they will keep on dividing and dividing and dividing. Adult stem cells have a limited ability. The biggest drawback of using embryonic stem cells is that they are foreign. Because of course you are retrieving from a source other than the patient, your own patient, they will cause an immune reaction. So this is one of their drawbacks. However, you can do nuclear transfer. Just so that you know, it is possible to make a customized embryonic stem cell. In future, maybe people will be using that. It's the same technology that was used to clone Dolly, the famous sheep, the first animal that was cloned. It was done through nuclear transfers.